Our next speaker is Steve Pitman. Steve is a registered general nurse and head of education and professional development at the INMO. He has worked in a number of organisations in the UK and Ireland, including Tala Hospital, the NMPDU in the Eastern Region Health Authority, and for 14 years worked in the RCSI as Programme Director on the Master's Programmes in the Institution of Leadership. So he's going to talk to us today about emotional labour, which I'm sure we're all familiar with at the moment. So,
Lovely. Thank you for that introduction, Hazel. I'm going to talk about burnout. Actually, that's what the session is going to be, which is a very important and topical area, particularly in the context of COVID-19. And I suppose one of the most important things to highlight, and is often misstated in relationship to burnout, is that for somebody to be burnt out, they must have burned brightly for a long period of time beforehand. So it's not a sign of weakness, it's a sign where the person has expended a huge amount of energy because they've often been overwhelmed. And just to show you my video there of burnt out matches. So in the context of COVID, psychological issues and the psychological impact of caring is very much coming to the fore. I'm going to talk about just very briefly about an INMO survey that was carried out recently, which we're still analysing the results. But just to say that nursing organisations and midwifery organisations throughout the world are interested in seeing what the psychological impact has been on members. The American Nurses Association have recently produced data. The Royal College of Nursing in the UK as well is currently engaged in surveys as well. So just as a general point about the survey that was carried out in the INMO, we looked at psychological and emotional factors that were impacting nurses as a result of COVID-19, because we were receiving information from members that was saying that it was having quite a dramatic impact. And what we initially have found is that there are very high numbers of nurses that reported COVID-19 has had a negative personal impact upon an individual's psychological health. And when they were asked about the impacts on their colleagues, an even higher amount reported, into the 90%, that COVID-19 had a psychological impact upon the colleagues they work with. And just a flavour of the type of things that come up, and these will be relevant to other things that I'll talk about, is that they reported high levels of mental exhaustion and after work finding it hard to recover their energy, and also physical exhaustion as well. We will be producing this report. There will be an outline in the World of Irish Nursing, and we will be sharing the data with members in the broader health worker community. Even outside of COVID, burnout has been a significant issue for nurses and midwives. The term burnout was first used in 1962 in a novel by Graham Greene. It was about a doctor in the Congo that was caring for patients, and it's about the impacts upon that doctor. The actual term came into its own in terms of healthcare and work and organisational psychology in the 1970s, and was probably made popular in the 1980s by Christina Maslach. And the group that was probably most researched and is most relevant to has been identified for about 30 to 40 years is nurses and midwives. But now when you look at the definitions of burnout, it actually applies to anybody that interacts with customers and the public generally. So we can see here within Ireland, in the acute hospital sector, nurses report moderate to high levels of burnout and low levels of job satisfaction. In COVID, you can see in the Nursing Times, Ford argued that nurses are feeling more stressed and anxious than usual, with a third describing the state of mental health as bad during COVID. And again, Annette Kennedy, the president of the ICN, former member of the INMO, stated from an international perspective there is strong evidence that nurses are experiencing unprecedented levels of stress and risk burnout, which is not something that we probably would have doubted. Howard Catton as well, nurses have always worked under intense psychological pressure, but the current pandemic is placing them under extraordinary demands. And it's important to highlight that word demands, because that is at the heart of how we understand the nature of burnout. So burnout can be seen from a physiological perspective in terms of the stress response, psychological, and also in terms of the sociological impact. Much of the research on burnout has been centered around the psychological, emotional impact of burnout. That's where people like Christina Maslach, her work has focused, but it also encompasses other areas as well. So this is the definition that came from Maslach and colleagues. Burnout is a prolonged chronic, so it is a long-term emotional and interpersonal stressor on the job. So this is where you're stressed on the job. So it's related to work and is defined by 3 dimensions: exhaustion, cynicism, and inefficiency. So the mental exhaustion or physical exhaustion, being cynical about your role, and also about things generally is one of the key characteristics, and being less effective in the workplace. So they're the 3 dimensions that are usually talked about when people focus on burnout and its effect on the individual. So it's a syndrome, as I mentioned earlier, that can occur amongst individuals that work with people, and nurses are classically the group that researchers have been interested in. Just as a sort of flip round, one of the changes that occurred in the last 20 years is to try to look at measures, instead of looking at the negative aspects of individuals, to look at the positive aspects. So the flip side for some people of burnout is work engagement. And just to point out, if you look back at what the elements of burnout are, you can see they're just turned around. So you can see that vigor, dedication, and absorption are the flip side of exhaustion, cynicism, and inefficiency. There's a variety of different ways of measuring burnout. The most well-known is the Maslach burnout inventory, but there are others, and there's also measures of work engagement. Probably the most recent one that's been introduced, and it is free of charge to use, is the burnout assessment test, the BAT, which has been developed in Holland. One of the things I probably want to just highlight is that Freudenberger and North highlighted that there are many phases in relation to burnout before you get to the burnout syndrome, the stage of burnout syndrome. So you can see these 12 steps where individuals try to overprove themselves. So they're working harder to show their contribution. They're neglecting their own needs. They're displacing conflict, so they're just, rather than defending themselves, they're just taking on whatever is coming at them. They look at their values, they deny emerging problems, they withdraw from their family and their work colleagues. And it leads to things such as depersonalization, feelings of emptiness, and depression. These are important because when we look at some of the impacts of burnout, and we look at some of the scandals that have occurred in the last 20 years, and one of the one that comes to mind is the Mid Staffordshire inquiry, where some nurses were described as callous and indifferent and cruel, which is shocking that that would be labels attached to nursing. But it should be remembered in the context of burnout, where people do feel depersonalized, they do feel empty and depressed, that perhaps it's the workplace that's actually created that scenario where you'd expect, all things being equal, that people have selected to be a nurse because they orientate towards compassion and caring. So something has happened along their work journey to arrive in the Mid Staffordshire inquiry as being labelled as callous and indifferent. One of the other characteristics of burnout is that it has a spillover and crossover effect. So if you have stress in work and you feel burnt out in work, it will cross over into with colleagues, or it will spill over into your family life as well. So it's not confined just to yourself or even to work. It has quite a devastating impact upon individuals, teams, and also services as well. What I just wanted to mention, I'm not going to go through these two elements, but they're important to consider when you're looking at any interventions related to burnout. Burnout is a motivational theory, and many of you will have come across Maslow's hierarchy of human needs, and maybe some of you have come across Hertzberger's hygiene theory. So the only thing I want to say about Maslow's hierarchy of human need is that Maslow talked about things needed to be in place before other things happen. So you need to have your physiological needs met before people are concerned about things such as safety, belonging, esteem, and self-actualization. So you need to make sure that certain things are in place. In a similar way, Hertzberger's motivational hygiene theory talks about hygiene factors and motivation factors. So hygiene factors are those that cause dissatisfaction but do not cause satisfaction. So if these are not in place, they cause dissatisfaction. When they are in place, they don't necessarily cause satisfaction, whereas motivators increase job satisfaction. And the point to make here is that unless you have the hygiene factors sorted out, you will never increase satisfaction in the workplace. So unless things such as status, pay, working conditions, job security are at a level the person feels comfortable with, it's unlikely the person is ever going to move to a point of job satisfaction. This is probably the most important slide in the presentation in terms of understanding work engagement and burnout. It's called the job demands and resources model. Burnout and both engagement as well being the opposite are a product of an imbalance between job demands and job resources. So if you are under huge demands, either physical, emotional, in terms of skill mix and staffing level demands, that will take its toll on the individual. So that can only be counterbalanced by things such as personal resources, so ways of coping, but also physical resources in terms of staffing and the working environment as well. And you can see in terms on the right hand side, Demaruto and Bakker in 2011, and you can see in this diagram where job demands is related to a reduction in health and energy generally and worse outcomes as well, whereas an increase in job resources relates to motivation and better organizational outcomes. And just to say, personal resources can be confidence, self-esteem, optimism, resilience, and so on. But the point I probably want to make is that there is often an overemphasis placed upon the individual being able to cope with burnout themselves. When it's a product of the work environment, it doesn't matter what the individual does, it is the work environment that is causing the stress leading to burnout. So it's something needs to change in the work environment. So it's a bit like saying to somebody, you're stressed, so you need to go on a stress management course for 2 weeks and then come back. And then put the person back into the stressful environment. The stressful environment needs to change. The HSE have introduced a wide range of interventions such as employee assisted programs, including counselling, relaxation, resilience programs, stress management programs. There's also clinical programs such as point of care foundation, Swartz rounds, where people are given space to talk about distressing issues or issues that have caused concern in terms of the workplace. Again, these are all focused upon what the individual needs to change rather than the work environment. HSE has a load of other interventions under their staff engagement interventions, their excellence awards, connecting better in terms of more emails, staff communications, and quality and improvement. And what I want you just to have a think about here is the point around the motivational and hygiene factors. So unless working conditions a change, people will not be satisfied. So what tends to happen with employers, and the HSE are no different, is they try to change the motivators without sorting out the hygiene factors, which ultimately leads to no change in terms of people's feelings of satisfaction and burnout. And I'm just coming to the end. One of the things that I think is an important concept that has emerged in organizational psychology is the notion of job crafting, about being happy in your job. And often the people who are the most happiest in their job are people who job craft. So these are the individuals that join the workforce, they are employed to do a certain job, and then they notice there's something in the job they particularly like. They like the wound management side of the job. So all of a sudden they carve out a part of the role as being, they become an expert on wound management. And then over time, they become the clinical nurse specialist, they become the expert, they become the advanced nurse practitioner in wound management, because that's what they want to do. And there's a higher chance there of job satisfaction and greater work engagement as well. So just in conclusion, just to highlight two issues, I suppose, is that individuals can develop coping skills, but burnout is often a workplace issue as a product of increased demands and a reduction of resources. Burnout is a real problem that employers need to understand, monitor, and take action. And just to the stark reality is that there is a need for an additional 9 million nurses globally by 2030. And to recognise that if we don't look after nurses and midwives, deal with things such as burnout, and recognise nurses and midwives are a precious resource, then we'll struggle to deliver healthcare and to meet national and international health goals into the future.